Hello, welcome to Chapter 4 of Introduction to Global Health. I'm Jeremy Whitaker. Let's get started. So, Chapter 4 kind of opens up this idea of barefoot doctors going through China. And these are people who practice kind of a blend of traditional medicine and Western medicine, doing vaccinations and some real basic checkups on people. And there was this idea that you didn't need a lot of money to provide primary care to a large number of people, which kind of sets the stage for what the chapter is basically about, called Health for All, the kind of conference at Alma Ata. And again, this where most of the world signed on to provide health for all, primary health care to all of its citizens, of course, by the year 2000. And then you can read the full thing on page 355 of the book. It's only about 3 pages long. And so, again, a very interesting time. The U.S., you can see a picture of Senator Edward Kennedy at the conference. We had Jimmy Carter as the president. So this is after the Nixon years, kind of very liberal, very, let's provide everybody with medicine and we'll lead the charge in the world. But in the meantime, they said, well, especially looking at the developing nation, what about selective primary health care, where we hit these kind of big ticket items, such as immunizations and breastfeeding and oral rehydration therapy and growth charting, or the GOBI acronym. We'll hit those things. That'll be the most bang for the buck while we set up clinics across the world. Then just 2 short years later, Ronald Reagan and Margaret Thatcher take over the 2 largest economies in the world, U.S. and Britain. They talk about neoliberalism in the book, but really a much better way to look at it is, say, more market-driven care. Reagan being a Republican and Thatcher, again, kind of a similar conservative ideology, saying, well, let the market provide health care for everybody, not government. So this grew into a thing called the Washington Consensus, when they loaned money or helped other countries stabilize the economy, to kind of liberalize, to again open it to elections, and privatize, going to move things out of government into the private sector, because that way you didn't have to fund governments to provide services, and so government could be a little leaner and a little cheaper. And this became the practice of the World Bank and the International Monetary Fund. Now, I believe the World Bank at this time was run by McNamara, who was actually the Secretary of Defense under Nixon. So again, you have these conservative kind of people who are very much let the market provide, like to keep government out of it, who are leading the world and kind of this restructuring. So again, it leads to this idea of the commodification of health, because if it costs money, it's a commodity, it must be distributed, it's limited supply. And so again, limiting government investment frees up that money. And so then there's this idea that they're requiring countries to charge user fees when they went to government clinics. That way, if the government's charging you money, well then private providers can also charge money, maybe make a profit, and have a chance against these government monopolies in health, and to kind of spur the market. This doesn't work. I hate to spoil it for you, but basically people, if they had to pay money and they couldn't afford it, they just didn't do it. The book talks about how bed nets that cost 75 cents each for pregnant women, they couldn't afford 75 cents. That's all they made in a day, 2 days a week. People who are living on bare minimum, they don't have money for these things. They don't buy them. So basically, you had a very damning report called Adjustment with a Human Face that said these user fees and these ideas are hurting people and driving people away from healthcare, and hurting other efforts in healthcare, even free things like immunizations, because people don't go to or trust the clinics anymore. So the book then kind of transitions into UNICEF, their selective primary care campaign. Of course, UNICEF being the UN Children's Emergency Fund. So again, they doing the most they can with limited resources, go with this GOBI FFF. So we talked about GOBI a couple slides back, but also including family planning, female literacy, and food supplementation, like vitamin A supplements. Cost less than $10 per child. It didn't require infrastructure. You didn't need, some of the vaccines they're using didn't require cold chains. You didn't have to have refrigerators. to keep the vaccine cold all the way along. They were shelf stable. So these things, again, could be done basically by a well-trained person with minimal tools. So they took this kind of Gobi FFF out on the road. They hit their 80% goal of getting people vaccinated in a lot of these countries, which is huge because you took epidemiology and you're familiar with the idea of herd immunity, where if most people are vaccinated in a community, it's hard for the disease to spread because there's no one to spread it to. And of course, this led to the vaccination day in Turkey and days of tranquility when they even shut down a war to make sure kids got vaccinated. So again, some really big, very visible victories in public health and vaccination. But the big downside, and what comes to bite them later, is that providing these services, which require no infrastructure, are great. But then if you don't set up an infrastructure, when those services and those people go away, there's nothing left. So AIDS hits Africa in the 80s and 90s, but there aren't clinics, there aren't doctors and nurses and pharmacies because nobody set up the infrastructure. So then finally, the chapter talks about financial institutions. And again, the World Bank, we talked about how a lot of their more conservative policies in the 80s, basically they were, in order for countries to get money to stabilize their economies, they had to agree to, eliminate or very much limit government-funded health services. And these countries' hands were tied. They needed the money to stabilize their economy. So yeah, they would do whatever the World Bank said. So again, their influence being influential, if not dominant. However, that adjustment with the human face report came out in the late 80s. The World Bank started changing their tune significantly. And in the 90s, they are a lead policymaker and lender of, again, HIV, family planning, nutrition programs, things they previously not funded, they're funding now. And then the World Health Organization, they're kind of silent throughout this because while a leader and they come up with model policy and what people should do, they don't have the money to back it like the World Bank and the International Monetary Fund does. So they don't have the power of those organizations. Then the World Bank, again, comes up with a report in 93 that basically saying too much money is spent, especially in developing countries, on tertiary hospital care, when the money would be better spent on prevention versus spending it all on more expensive hospital care. And again, that's in your book and the pages are there. So that's chapter 4. Now looking at your assignments. Again, week 3, the discussion board, you need to track down a global health article off the internet. Some resources were posted to help you find them. Week 4, you're going to talk about Cuba and Tanzania, which were mentioned in this chapter, about after Alma-Ata, even though they had limited resources, really ran with the primary healthcare movement. And then your homework, these are both fairly big assignments. The paper on a historical epidemic, saying that happened before 1700, and assignment 4, where you're going to pick a country in Africa that's not South Africa, and use the CIA fact book to kind of give a summary according to the 3 parts on the assignment. Thanks for watching, and